You're going to look at the chest. You're going to look at the shape of the chest. Again, is it a big barrel chest or is it a more normal chest? Look at the symmetry. Your chest should be fairly symmetric. Is there any tenderness on palpation? So you have your patient and you're going to kind of palpate their chest. So there's their sternum, there's their ribs, right? And so you're gonna palpate using your hands, and you're gonna kind of push in. Have them take a deep breath as you're pushing, and if there's any part that hurts, you want to make note of it. Is there any crepitus? Crepitus is a fancy word for the sound and the sensation of bone ends rubbing together. So you have a fracture, right? You've got your little bone here, and it's got a fracture, and there's the part that fits in. That's kind of a funky looking bone. Whoops, it's a really funky looking bone. Anyway, these bone ends, if they rub together, they do make a sound, and you feel it really more than hear it, but that's called crepitus. The other thing you're going to assess for on the chest is use of accessory muscles. So again, here's my patient with their ribs, sternum, and the ribs. And you can't necessarily see the ribs, but there are these little muscles in between the ribs here, in between the ribs, and those are your accessory muscles. There's also some up here, kind of a little triangular shape at the top of the sternum, and in normal breathing, you don't really see these muscles kind of sucking in and getting pushed out and sucking in and getting pushed out. But when somebody's really having a hard time breathing, these accessory muscles are going to be used. So you can actually note if the accessory muscles are being used to help them breathe. And then you're going to look for any tissue damage. So this could be cuts, cuts, bruises, anything that you see that's caused tissue damage. Then you move down to the abdomen. You're going to palpate all 4 quadrants. So it's your patient, there's their belly button, and you've got your kind of imaginary quadrant lines here. And you're going to palpate. If your patient's complaining of abdominal pain, then ask them where. If they say it's right here, then you're going to start palpating here, and then here, and then here, and then you come and you'll gently palpate around. Abdomens in general should be soft and squishy. There's very little that we can really feel in the abdomen and identify. Doctors who do it a lot can sometimes identify the liver up over here. But really, there's not much that shouldn't be soft and squishy. So abdomen should be soft. They should be non-tender. Guarding, so guarding could be that they're pushing you away, or that they tighten up their abdominal muscles to keep you from pushing on whatever hurts. You want to feel for any masses, and there shouldn't be any. If you feel a mass, then that's a concern and you need to mark it down. You want to feel for symmetry, so their abdomen should be symmetric, and look for symmetry, I guess. And again, you're going to assess all 4 quadrants. So we move down even further and we assess the pelvis. Let's see, we got our little pelvic girdle here. So there's our patient, there's their pelvis, and you're basically going to squeeze kind of in. So use both hands, squeeze in on the pelvis, and you just want to feel for stability. A broken pelvis is fairly easy to identify as long as you actually assess it. And a broken pelvis is a big deal. It takes a lot of force to do that, and it's generally associated with a high level of blood loss. So assess the pelvis for stability. We do want to assess the genitalia for any bleeding. And one of the things that the National Registry Skills Sheet has you mention is assessing the perineum. So the perineum is the area between the genitalia and the anus. It's that little area of skin there. So you need to assess that for any kind of injury, damage, or trauma. For the back or buttocks, assess for tissue damage, and for the back, assess for step-offs. So again, this is going to be bruising, lacerations, abrasions, etc. The extremities, assess for stability. So feel all of the bones. You've got 3 major bones in each of your extremities. You have in the arms the humerus and then the radius ulna. In the legs it's the femur and then the tibia and fibula. So feel all of those. Feel for stability. You want to feel for crepitus. Are there any bone fragments rubbing together? Check for a pulse, and this is in the hands or the wrist and the feet, and at each extremity to make sure that they're present. Assess for motor function. Can you wiggle your fingers and toes? And assess for sensation. Can you feel me touching your hands and your feet? A detailed head-to-toe is required for any unresponsive patient. The patient can't tell you what's wrong, so you have to try and find all of the problems on your own. And any multi-trauma patient also needs a detailed head-to-toe. And this could be as something as simple as, yeah, I rolled my ankle and then I fell to the ground while I was playing football. You know, I was playing catch out in the backyard and I tripped, I stubbed my toe, but I fell and hit my head too. So those you're going to do a detailed head-to-toe. It's also required really for any patient with significant mechanism of injury. If the mechanism of injury could have caused serious injuries, then the EMT needs to actively assess and address any additional injuries. So here's what to look for. Decap BTLS, and you guys should know this because it'll actually make your lives a lot easier if you do. Deformities, contusions, that's bruising. And deformity means something doesn't look like it should or doesn't feel like it should. Abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling. So there you go. This is everything to look for. When we talk about tissue damage, this is our mnemonic for helping us remember all the different types of tissue damage. So now our last step is our reassessment. The purpose here, we want to identify and treat any changes in the condition. We want to monitor the effectiveness of anything we've done to intervene. And then we want to identify any trends and vital signs. So when we do vital signs, it's going to be every 5 minutes or so in our critical patients and every 15 minutes in our non-critical patients. And we want to see, are there any changes? Like I just said, 5 minutes unstable, 15 minutes for stable patients on your reassessment. So this is going to include repeating your primary assessment. So are the patient's ABCs still intact? Reassess vital signs. Ask how they're doing. Are there any other complaints? Check any interventions, and then compare to your previous findings. So that's assessment. That is the basics. We're going to get lots of practice with this. I know this lecture was long, but there's a lot to talk about with assessment, and it's a really important skill. So start going over the skill sheet and come into class ready to do some assessments.